to stop. Skin to skin, keeps your baby nice and warm. Cross cradle, support your baby in your arms. It may take time, but be patient. Feed her on demand, don't keep that baby waiting. Teach me how to breastfeed, teach me how to breastfeed. Teach me how to breastfeed, teach me how to breastfeed. All the babies love it, all the babies love it. All the babies love it, you ain't messing with my breast milk. Teach me how to breastfeed, teach me how to breastfeed. Teach me how to breastfeed, teach me how to breastfeed. All the babies love it, all the babies love it. All the babies love it, you ain't messing with my breast milk. Your milk is filled with lots of vitamins plus immune protection that only you can give. The first milk, we call it liquid gold, perfect for a newborn that's only 1 day old. It's super sticky and it's thick like honey, just the right amount to fill your baby's tiny tummy. So when you see that poop and you wanna scream, by day 2, it should go from black to green. If his poops are frequent and a mustard yellow, you're doing good, so let it flow. Don't forget to nurse on both sides. Sit back, relax, and stare into your baby's eyes. You can be an A cup or a triple D. You'll still make all the milk your baby needs. Healthy and strong, your baby will surely grow. A bond that lasts forever, only you will know. Teach me how to breastfeed, teach me how to breastfeed. Teach me how to breastfeed, teach me how to breastfeed. All the babies love it, all the babies love it. All the babies love it, you ain't messing with my breast milk. Teach me how to breastfeed, teach me how to breastfeed. Teach me how to breastfeed, teach me how to breastfeed. All the babies love it, all the babies love it. All the babies love it, you ain't messing with my breast milk.
Customization and safety are at the heart of Amita's commitment to mothers. The Amita Platinum hospital-grade breast pump provides both innovative features and advanced technology. Its Amita Hygienic Milk Collection System, known in Europe as the Hygiene Pump Set, is the world's only breast pump kit with proven airlock protection. Its protective barrier keeps the breast pump and tubing dry while pumping. Mold and bacteria can easily grow in pump tubing when moisture becomes trapped inside it. With proven airlock protection, the solid diaphragm keeps the air from your pump from coming in contact with your milk while pumping. Even if the milk container is turned on its side or upside down, moisture and milk aerosols will not enter the tubing or the pump. With this solid barrier, you don't have to dry or clean the narrow tubing. Amita's exclusive proven airlock protection helps prevent contamination and simplifies pump care. To use the Amita Platinum Breast Pump, first attach the power cord to the back of the pump. Then plug the pump into an electrical outlet. Before pumping, always wash your hands well with soap and water. Your Amita Hygienic Kit comes pre-assembled. If it's marked sterile, you may use it right out of the package. If your Hygienic Kit is not sterile, before using it for the first time, boil those parts of the system that come in contact with your milk for 20 minutes to sanitize them. This includes all parts of the collection kit except adapter cap, tubing, and tubing adapter. After boiling, let these parts air dry. To assemble the Hygienic Kit, first insert the diaphragm into the upper chamber of the breast flange. Then, snap the adapter cap, with the tubing attached, onto the top of the upper chamber. Next, hold the white valve carefully by the thick sides, not the flat edge. The valve will compress slightly. Gently push the white valve firmly onto the ring on the underside of the breast flange. The white valve is vital for proper suction and should always be handled very gently. Next, screw the collection bottle into place. And finally, push the tubing adapter with tubing attached into the tubing adapter port on the pump. The tubes from both collection kits should be plugged into the tubing adapter. If you are going to single pump, simply remove one tube and close it with the tab on the tubing adapter. When you hold the flanges to your breasts, make sure your nipples are centered in the nipple tunnel. Hold them firmly, but gently, to create an airtight seal around your breasts. Start your Amida Platinum breast pump by pressing the power button. The pump starts at the lowest suction setting. Push the up arrow of the suction button until it feels slightly uncomfortable, and then turn it down a little until you reach your highest comfortable level. Pressing and holding the button will increase suction by units of 10. Pressing and releasing the button will increase suction by units of 1. Use the highest suction setting that feels completely comfortable to you. If you feel discomfort during or after pumping, use a lower suction setting. The Amida Platinum is the only breast pump with VacuSense technology that internally monitors the pump suction so it matches the level you choose. With VacuSense technology, your pump suction continues to stay at your chosen setting when you pump at different altitudes, even during single and dual pumping. Like a breastfeeding baby, the Amida Platinum breast pump starts at its fastest speed. When your milk begins to flow, this is known as a letdown or milk release. This natural reflex pushes the milk out of the breast and is the most important part of successful pumping. During each breastfeeding, most mothers have 3 or 4 milk releases, even if they don't feel them. When your milk flows faster, you can use your pump controls to follow your flow. To do this, use the down arrow of the speed button to find the setting that produces the fastest milk flow. Pressing and holding the button will decrease speed by units of 10. Pressing and releasing the button will decrease speed by units of 1. Your best speed setting may vary at different pumping sessions. When your milk release ends and your milk flow slows, try pressing the up arrow on the speed button. A faster speed may trigger the next milk release faster. Many mothers pump more milk in less time by using a faster speed to trigger milk flow and a slower speed to drain it. Repeating these fast then slow speed settings several times is what we call multi-phase pumping, which mimics a baby's nursing pattern at the breast. But these suggestions are just a starting point. Always use the pump settings that work best for you. Amida's custom control was designed with you in mind. To trigger a milk release, it may also help to gently massage your breasts or apply a warm compress. Flange fit is important for comfort and milk flow. What determines breast flange size and your fit is the width of the flange opening. With a good flange fit, you should see space around your nipple as it moves freely in the tunnel during pumping. If the breast flange is too small, your nipple may rub along the tunnel's sides or move very little. If the flange is too large, too much of the breast may be drawn in, and it may be hard to get a good air seal. For a better fit, Amida's custom fit flange system offers 7 different breast flange sizes, which adapt to all Amida breast pumps and kits. If your pump or kit includes more than one flange size, try each one to see which is most comfortable and produces the best milk flow. Flange fit can change over time, so check your flange fit every few weeks. If you have small nipples and the flanges included with your pump kit are too large, a reducing insert or flexi shield may improve your comfort and milk flow. If the breast flanges included are too small, larger sizes are available. These larger sizes, called custom-fit flanges, can be purchased separately. As you pump, tilt the collection kit down slightly so your milk flows into the bottle. Close your eyes, relax, and imagine your baby nursing at your breast. Dual pumping takes much less time than single pumping. When dual pumping, allow 10 to 15 minutes per session unless your healthcare provider recommends another pumping time. If you single pump, switch breasts about every 5 to 7 minutes and allow about 20 to 30 minutes total per session. To make it easier to pump for the recommended time, the Amita Platinum Breast Pump features a timer that starts when the pump is turned on. It can be reset by pressing the button under the timer. The timer and pump automatically turn off after 60 minutes. When you finish pumping, turn off the pump by pressing the power button. Then remove the flanges from your breasts. If necessary, break the suction by inserting a finger between the flange and your breast. When the suction is broken, remove the flange. The pump's built-in bottle holders can securely support any size milk container or storage bag. Finally, unscrew the bottles and screw the locking caps into place. Follow the milk storage guidelines you're given.
Quick Clean Micro Steam Bags are perfect for sanitizing your breast pump parts and feeding accessories a few times a week. In only 3 minutes, using just a microwave and water, Micro Steam Bags eliminate 99.9% of common bacteria and germs. They're also great for storing your pump parts until you get home. Quick Clean breast pump and accessory wipes are a convenient way to clean accessories between pump sessions. They're convenient to take with you anywhere. Quick Clean breast milk removal soap, Micro Steam Bags, and wipes are convenient ways to clean anything that touches breast milk. Medila's complete line of Quick Clean products save time and make cleaning your breast pump parts and feeding accessories easy for busy breast pumping moms and their families.
My name is Jane Morton, Dr. Jane Morton. I'm a pediatrician, and today I want to talk to you about breastfeeding a premature baby. I hope that I can help you by making this very memorable and very simple and practical. And I really hope at the end of this talk that you come out feeling that breastfeeding a premature baby is not just simply about making milk, which is what a lot of mothers sort of feel they're there to do. So to make it very simple, we're going to break it down to A, B, and C. And A is attachment, meaning how does the baby learn how, the rather sophisticated technique of learning how to latch onto a breast and use her jaw and tongue to massage milk out of the breast, because a baby doesn't use the nipple as a straw, but uses her jaw and tongue to massage milk out. Then we'll talk about B, or breast milk production. It's true that making plenty of milk is the key to successful breastfeeding, so it's super important. And then we'll talk about C, or calories, the baby's consumption, what the baby gets. And first we'll talk about, for each one, A, B, and C, we'll talk about sort of how nature ideally designed it, and then we'll talk about you and how you can take these lessons from nature and apply them to your own situation. So we'll start with A, attachment. Every mammal, right after birth, the baby recovers for a brief period of time, as if he or she is a nice healthy baby, fills his lungs up with air, kind of recovers, and then starts smacking his lips, moving his head around, and gradually moving towards the breast. Now, how did he learn to do that? Why is he doing that? The reason is that he's trained. He's trained to do that because before he was born, he was bathed in this wonderful amniotic fluid, this ocean of fluid. And in the fluid were these pheromones, or very powerful scents or smells. And these smells are unique in each mother. And they depend on your genes and they depend on your diet. No two mothers are identical. And the interesting thing is, these pheromones have taught this baby for weeks and months to suck, swallow, turn, root towards pressure, and find the source of this smell. And not surprisingly, breast milk has the identical smell, particularly strong in colostrum, which is what I'll call first milk. And so once he's born, he's actually not hungry. He's programmed to seek out this source. So he doesn't find the breast and latch on because of vision, but because of scent. And his sense of smell is stronger at birth than it'll ever be again. In fact, the first nerve from the brain, the cranial nerve 1, is for smell. Now, how does this apply to you? Now, your baby too is familiar, maybe not quite as familiar, but familiar with this scent. And your baby too is familiar with your touch and being held by you. And every intensive care nursery in the world now knows from very good science that one of the most powerful things that can happen to this baby, whether he's sick or just little and recovering, is to be held by you, because it is your scent, your warmth, your holding, this skin-to-skin holding that is so critical to his learning these baby steps of breastfeeding. And I don't mean t-shirt to bra, I mean skin to skin, right between your breasts or right on your breasts. So over time, he'll gradually learn all the same little nutritive behaviors of rooting and sucking and swallowing that a term baby will. And there's no urgency on this. You can relax about this. Time is on your side. But there's one caveat, and that is any baby, even term babies who have difficulty with latching on, do a whole lot better if your production is high and the milk flows easily for him, and he can make little mistakes with his jaw and mouth and still access the milk. That leads us to B, breast milk production. How do you get your production high? Well, let's now go back again to Mother Nature and the first hour. And think this time of every mammal, and think that, after delivery, especially a mammal that's had, multiple babies, like let's say a puppy dog who's had 10 little puppy dogs, wouldn't you think that that mammal would feel like, give me a break? I don't want to learn about this nursing right now. But as nature dictates, this is the prime time to stimulate your production. This is the time you phone in your order for how much milk production potential you're going to have weeks from now. That's because it isn't hormones that stimulate your milk production automatically. It's the frequent and the effective and the early removal of first milk that programs your breasts. And so it's sort of like a rocket ship. It's sort of like when you launch a rocket ship, the energy goes into the beginning. This is boost off time. this is the time you don't fool around. You don't begin to celebrate the birth of a baby or even worry about the baby in the NICU at this point. This is the time you get serious about expressing milk so that you can do what nature wanted you to do. So what does this look like for you personally as a mother of a premature baby or one who expects to deliver a premature baby? Ideally, this is what happens. The baby's born, and in the operating room or in labor and delivery, you just use these wonderful tools called your hands. And you use your hands, and they're very comfortable, and you massage out the milk just as the baby would from the very first hour. And you do it as much as you can. You do it when you're on the phone. You do it when you're in the shower. You do it when you're beside your baby. You just do it, do it, do it. Because the more you get out, you're not wasting it. The more you get out, the more you produce. You're turning on the factories in your breast at this point. So if you have a baby who's in the NICU and probably will be in the intensive care nursery for a while, you'll also want to use a breast pump, a rental grade electric breast pump. But what we know is that mothers who use very frequent hand expression in the first 3 days, only the first 3 days, plus a pump, produce far more milk months later. This is probably because breast milk is so viscous that pump suction can't pump it out as easily as your hands can massage it out. Plus, mothers find their hands much more comfortable than a pump. The other thing that we've learned from our studies is that once your milk supply starts picking up, which it usually does around the 3rd day, that using a technique called hands-on pumping, where you use both the suction of the pump and your hands together, means 2 things. You get more milk, and your milk is richer. It has more fat, which is really important for the development of your baby's brain. So there are 2 wonderful videos that I want you to watch, both on the Stanford website. Just Google Stanford breastfeeding. One of them is about hand expression, and these are mothers with premature babies showing you these techniques. And the other is called Maximizing Milk Production, and that tells you how hands-on production works. So, even though you can relax about attachment, with production, this is where you need to really get pretty serious. So this leads me to calories, or C. A, attachment, B, breast milk production, and now C, calories or consumption. You might wonder why in the first hour babies are so aggressive at getting to the breast. It's not because of hunger, because they've had their last meal through the umbilical cord, and it was cut after he was delivered. So he's not really hungry. But as nature designed it, he needs to be protected. And your milk has concentrated double whammy protection. And by that I mean you give him your own unique antibodies. And he also gets these bioactive factors that are only in breast milk, not in formula, that stimulate your baby's own immune system. And so he begins to become stronger himself with your colostrum. So let's take a look at this for you. You've probably noticed by now that breastfeeding a premature baby is not like a term baby, in that with a term baby it would be A, B, C prioritized, and that would all work out well. But for a premature baby, it's sort of the reverse. It's sort of B, C, A. And the road to attachment, again, can be long. Usually these tiny little babies, by the time they get to their due date, they're pretty good nursers. But again, that depends on the demanding work, and I know it's demanding, of getting your production up high soon. The littler the baby, the higher you need to get it. But what I want to close by telling you is that again, this is not all about making milk. This is like sort of giving your baby back what he missed by being born early. What you're giving him back is, as best you can, duplicating his in uterine experience. He's getting your warmth, he's getting your touch, he's getting your skin to skin, he's getting your scent, he's getting your immunities, he's getting his nutrition. So he's getting all of the things in that respect that he would have gotten had he not been born so early. But more importantly, this is how he keeps the connection with you. And this is how you keep the connection with him. And that's vital. So breastfeeding is not just a gift to your baby, though it is. And it's not just a gift that only you can give, though it is. It's a gift that you receive as well. It's a real giving and taking. And the benefits to you and to your baby don't end when you wean a baby. They last for the end of your life. There are many, many protective features about breastfeeding that program you so that you as a mother and this is your little baby will be protected for life.
In the first few days, effective removal of the very small amounts of colostrum on a regular basis stimulates production. Many babies who are with their mothers need help and time before learning to breastfeed effectively. Hand expression and spoon feeding after breastfeeding can provide more stimulation to the breast and more milk for the baby than breastfeeding alone. Mothers who are separated from their babies need to begin pumping within hours of delivery. Some mothers find it difficult to remove colostrum with an electric pump. In the first 3 days, using both the pump and hand expression can increase later milk production. This mother is learning to hand express for her 1-day-old son, born at 28 weeks gestation. A 1 cc vial works well for both collection and transportation of the milk to the intensive care nursery. A new mother who can effectively express small volumes of colostrum into an appropriate sized container and watch it being given to her infant can better understand the important protective role only she can provide for her baby. Whether your baby is premature or term, here are some steps to help you get started. It is very simple to learn and teach hand expression. In the first couple of days, the average size of a good breastfeeding for a term baby is only a teaspoon. So all we expect to express each session is a few drops to a teaspoon. The more frequently milk is expressed, the sooner milk comes in and the more milk is produced. Partners can help if mothers are too sick. Mothers may find the following suggestions helpful. Have the mother sit up so that gravity is working for her, not against her. Use gentle massage over the breast with hands, a soft baby brush, or a warm towel. It'll help get the the milk beginning to flow. Already we can see just with that.
Oh, yeah.
That just the massaging.
That's
Exactly. That's really good. Place fingers an inch away from the areola, making a C. Band-Aid markers make it easy to remember finger placement. I'm not going to get my fingers down here with a C. I'll keep them here so that the nipple is in the middle of my thumb and my pointing finger. Apply steady pressure inward towards the breasts, never massaging outward towards the nipple or the spoon. So back and then very gently together, and back and very gently together. And I don't expect to see anything in the beginning. So just know that in the very beginning, even when the baby nurses, she doesn't get anything. She's just beginning to sort of stimulate the milk to let down. And then, and the reason I just go very gently is so your breasts get kind of used to it first. And rather than stay on one breast, I go back and forth. So I go from the right to the left, and right to left, and back and forth. When I push back, I don't tighten up the skin, the dark skin. I don't pull like this. I just go straight back and together, and straight back and together. And then we'll get the milk flowing a little bit, and then I'll show you how to do it. And then we might as well start collecting a little bit.
Yeah, sure.
So remember when you try to do this yourself, that in the beginning the milk didn't come very easily, and now it's coming very easily. Think of press, compress, relax. Press, compress, relax. In contrast to the breastfeeding baby, who, with her tongue and jaw, massages the ducts beneath the areola, with hand expression, we apply compression further back and deeper into the breast tissue. Press, compress, relax. Press, compress, relax. You make your hands really, really relaxed, and I'll do it for you. And I'll push back, and then we'll come together. And we'll push back and come together. And then relax totally, push down, and come together. So it's sort of press, compress, and relax.
Okay.
Press, compress, and relax. Go back and forth from right to left to right to left. By alternating sides, the bursts and pauses of milk expression simulate the normal pattern of suckling of a baby. Avoid tightening or stretching the skin over the areola. Think of almost pooching it together, then push back, and then come together.
Oh, yeah.
You see, if you tighten it, it doesn't, think of it the way it's inside a baby's mouth. If you make it a little bit looser like this first, and then kind of push down and come together, I think you'll find that it comes out a little bit more. If I tease back like this too much, then I suppose I'm blocking the ducts.
You pinch,
Yeah,
then you press,
and then come together. That works a lot better, doesn't it? Develop a rhythm like a baby nursing. That is just perfect.
Wow, that's a lot.
The more frequent hand expression is used, the easier it becomes, the earlier milk comes in, and the more milk mothers will make. The vials or syringes of milk can be collected in a cup of ice and taken to the nursery for the baby. After breastfeeding, hand express and feed this to the baby from a spoon when she is propped up. The more often you do this, the better. The more milk a mother has, the easier for the baby to breastfeed. Think of it this way. You are phoning in your order for lots of milk later on. Once your milk comes in, and when you can depend on your baby to keep your milk supply steadily increasing, you'll no longer need hand expression to help empty your breasts. Many natural steps in life, such as learning to sit or walk, take a helping hand. Breastfeeding takes a little practice before it becomes as automatic as walking. Learning how to use your hands can make early breastfeeding easier.
I guess I'm having a little trouble.
You're having a little trouble with what?
Getting him to feed properly. He's having trouble latching on, and honestly, I'm getting a little sore. So.
Okay, well, let's work on it.
Partners play an important role in helping out.
I'm going to be showing Teresa some information, and when I'm gone, maybe you can kind of fill my shoes and help her out in the same way.
Okay.
I'm going to wash my hands for a minute. Take your time and get yourself sitting up as straight as you can in bed.
Early on, sitting straight up makes breastfeeding easier than if you recline. Begin with hand expression. Just a few drops of the early milk entices your baby to open his mouth. After your milk comes in, especially if you became too full, you could soften the breast to fit more easily into your baby's mouth when he latches on. So with hand expression, you can start the milk flowing, soften the breast for the baby, and encourage him to open his mouth wide.
And really relax your fingers more this time. So your fingers are really, really wide,
Okay.
and then pushing back and together.
I
Good.
see. So really far.
And that's right.
And then
Exactly
really
right.
together. Okay.
The crucial step is for the baby to draw not only the nipple, but part of the breast into his mouth. His mouth should cover more of the area below the nipple than the area above. This way, the protected nipple is far back in the baby's mouth, pointing towards the roof. Here, the nipple is not abraded or rubbed by the baby's tongue or jaw. When the baby is latched on well, he uses his jaw and tongue to massage the area of the breast below the nipple. In contrast, when the baby is not latched on well, he can only suck on the nipple. There's very little flow of milk out of the breast when the baby uses the nipple as a straw. Milk flows well when he compresses breast tissue, not the nipple.
And now, when he latches on, if his lips are like this, your fingers will be parallel to his lips.
And out of his way.
And so, and out of his way, so he can latch on and pull the nipple back way far in his mouth. Now, let's say, for example, that he was on the wrong way. Let's say that he was just on like this. This way, he gets no milk out. If we get him on the right way, he uses his jaw and tongue and massages milk out of the breast.
Okay.
Okay? So he gets on the wrong way, you get sore, he gets no milk. He gets on the right way, you feel fine, and he gets fed.
Okay.
Babies love the combination of skin-to-skin contact and the smell and taste of the express drops of milk on your breast. A perfect way to begin breastfeeding.
Let's remove some of these barriers and get a little closer so he can get a little closer to his mommy.
Begin by positioning the baby with your arm running along his back, with your hand making a secure C at the base of his skull. His nose should be at the level of your nipple. This position gives you the best vantage point for seeing how the baby latches on. It's easier for the baby to draw the nipple far back into his mouth if the breast is first shaped into a sandwich. Your fingers will run parallel to the baby's lips and back away from where the baby's mouth will be. The baby becomes interested by the touch of the nipple and the smell and taste of milk, so tap his lips with the expressed milk and nipple. Wait for his mouth to open wide. The sandwiched breast is then positioned deep into the baby's mouth. Relax the sandwich hold only after the baby begins sucking and secures the breast in his mouth. Notice here, when the baby starts, his head is tipped up. The nipple points towards the roof of his mouth, not his tongue. His chin presses into the breast more than his nose. and the baby comfortably massages the area of the breast below the nipple. Now, if instead the baby is positioned poorly too high up, he must bend his head down. See how this makes it difficult for him to draw that lower area of breast into his mouth? More likely, his lower jaw will just be at the base of the nipple, and this could be painful.
And
Oh, he
he'll
doesn't even
sort of-
want to. Yeah.
Well, some babies now.
Oh, ow.
Yeah, you see what I mean? Now, if we drew that imaginary line from the tip of his nose to his ear, midway in between is there, where the nipple's supposed to be, but it's right there.
It's not doing any good.
Yeah, so that he's just using your nipple as a pacifier.
Mm-hmm.
And that does not feel good, and that's how you get hurt.
The critical signal for your breast to make milk is to remove milk, especially this early milk. If your baby is removing milk effectively, he'll keep a sustained sucking pattern, not just a few bursts of 2 or 3 sucks. Many term babies take a couple of days to learn this. Premature babies take longer, and they can use the same hands-on help until nursing becomes automatic. While your baby is learning how to breastfeed, you can follow up each nursing with hand expression and spoon feeding. This would be wise for any mother who needs more help to build her milk supply, such as the mother of twins, or the mother with breast surgery, or the mother of a baby born a couple weeks early. Within a day or two, this will become automatic, and your baby will latch on without any help. Until then, your hands may help him learn.